So speaking of the psychedelic and mushrooms and such, how does ketamine compare to other psychedelics like psilocybin and MDMA in terms of effects and applications? Because I'm sure there's many of our listeners have probably tried those, but maybe have never tried ketamine.
Yeah, I think they're all effective, and there's they help with everything. Depression, anxiety, PTSD. I mean, when you think about it, a lot of the symptoms are the same, right? Mm-hmm. Feeling distant, difficulty with sleeping, right? Feeling hopeless, right? I think anyone that's anxious, I think anyone that's depressed or stressed out has those kind of symptoms. And it seems that all these different psychedelics, it's like taking a different trail or pathway up the mountain, but the view from the top is still the same. Everyone still gets those same results of feeling this connection with the universe or connection with other people around them. They feel less triggered by the things that would normally annoy them or send them into this negative spiral, right?
Sure.
And they just feel, this new appreciation for life, so some might not work for you. Some people might have an affinity to ketamine or psilocybin and MDMA. Really, the only way is by trying it and finding out. But right now, ketamine is the only legal psychedelic in the U.S. So if you want to take it legally and in a controlled setting where a medical provider is monitoring you the entire time, then I would still suggest trying ketamine. I think even when the other stuff is legal, ketamine is still a good starter psychedelic because it's an hour infusion. And then after we stop the infusion, about 10, 20 minutes later, that psychedelic effect is worn off. You're still going to be groggy for a few hours. You may be nauseous, but pretty much any psychedelic is going to make you nauseous, right?
Yeah.
But with psilocybin, the effects, 4 to 6 hours. LSD, even longer, 6 to 12 hours sometimes, especially if it's double dipped, right? Yeah. DMT, it's short if you smoke it, 10, 15 minutes, but that's like a rocket ship to outer space. It's a very jarring experience, right? So it might not be great for someone that's really struggling and vulnerable at the time. So I would say that's something to try next after you've had your experience with ketamine.
Yeah, great answer.
Yeah, I like to say intravenous ketamine is the most controllable psychedelic medicine experience on planet Earth, especially when you have it on an infusion pump, because we can literally stop it and pull you out of a deeper, challenging experience in less than 10 minutes. And those other psychedelics, like the classical ones, they, from a mechanism of action standpoint, like LSD, psilocybin, DMT, they work on the serotonin 5-HT2A receptor, whereas ketamine just antagonizes or blocks the NMDA receptor. So to really kind of understand these things too is that the NMDA receptor is just a calcium channel. Calcium's a positive ion. So if we're blocking a channel where calcium's going to go in, we're blocking excitation of a cell. So we're blocking cells' ability to talk to one another. And that's why ketamine works as an anesthetic, right? So ketamine can go a very low dose and be psycholytic. And then when there's a spectrum up to anesthesia. So in our clinic, we start out with that psycholytic low dose. I call it ketamine 101, just dipping our toe in the psychedelic medicine pool, and then working up to the psychedelic and dissociative or out-of-body experience. Whereas the other ones, you can't titrate it that way. So just different mechanism of action. I think all of them have their application, but I think if someone has never done any psychedelics at all, but they're curious, ketamine is a really controlled, safe place to start.
So I was actually having a conversation, I can't remember who with, but we were talking about the intravenous delivery system that you use and the reason why you use that so that you can titrate it and, bring somebody out if the experience was too intense or uncomfortable. And they were curious how you were able to do that so quickly. How does that work? Like bringing somebody out and having them come down within 10 minutes. How does that work?
Yeah, it's 100% bioavailable when it's IV. and then it's just like rapidly metabolized. And so you can
Got
come
it.
out of that peak experience quickly. It's called plasma concentration.
Okay, cool.
So very quickly, your blood plasma concentration of ketamine changes once we stop the infusion, and then you're not having that deep experience. And so the first time, though, is like so light that literally if we stopped it within 5 minutes, you'd feel like a little buzz, but like you're going to be out of that deeper, challenging experience. And then we teach you grounding techniques, and we'll reassure you, and it's really go back to the breath, right? This is all after patients already had an hour preparation session with our integration coaches, and they have our workbook, and where we've talked to them for 30 minutes before they enter the infusion. Dr. Sharma was like our original guy to walk patients through meditation and breath work and being the curious observer, right? So it's like we really prepare you. But every clinic is different. So like definitely like do your due diligence if you're thinking about ketamine and you're listening to this podcast. Like look at what each clinic is like and talk to them and see the reviews. That's important. Like make an informed decision for sure.
Yeah. I was recently in Austin and talking to some friends who are working in a ketamine clinic there. And they're doing intramuscular, and they said that it was more of a psychedelic experience in the intramuscular delivery method. And can you share a little bit more about that and what that might be like and why that is? I'm just curious.
Well, honestly, I would have to disagree.
Okay.
Here's the thing with the routes of administration. So I can make IV very psychedelic from the start because you can give a bolus or a push of the medicine right up front and then just drop you right in.
Okay.
And that's what intramuscular is doing, right? You're just giving a bolus or a shot. And I say like intramuscular gets you in the ballpark, but I'm trying to get you in the front row seat.
Okay.
And that's what IV does. So I can still give a bolus in the beginning, drop you in, right? And then now the infusion's going. We go back in at 30 minutes and we do a check to see if a patient wants to go deeper into the experience, and I can give another bolus.
Okay.
Right? So I can do that same thing, but most people don't realize that. And most clinics don't do a bolus dosing. We're anesthesiologists. We truly understand the medicine.
And you've been working with it forever.
Exactly. Yeah. We've done over 4,000 infusions in our clinic. Like we really got this down to a science. Dr. Wong is our third partner. Shout out to him. He's not here right now. But collectively, we have over 40 years of anesthesia experience amongst the three of us.
Wow. That's incredible. Well, I know I would definitely feel safe in any one of your capable hands. That's for sure.
Yeah, for sure.
Yeah.
Thank you. Just to add to that, though, I'm sure why they felt that way is because when it is administered intramuscularly, you get that sharp increase.
Yeah.
So you peak a lot faster. So that's why it feels more psychedelic, but it also fades away quickly. So it does help to get redosed with another intramuscular injection halfway through, but we could still recreate that with IV. I mean, there's a reason why when you're sick, it's an emergency, you go to a hospital, they're not injecting you intramuscularly. They're starting an IV because they want to make sure that they're getting the intended effect and they're able to titrate to effect easily.
Yes.
You can't really do that with any of the other modalities.
Right.
So we always say IV is like the Rolls Royce of administration when it comes to ketamine or any other medication.
Sure.
The other thing I want to add on there too is that with IV, now I can give you anti-nausea medicine like Zofran. If someone's really anxious, we'll give a little propofol in the beginning. If someone has like a headache, we can give Toradol, right? So there's all these other things. We add in other things that are proprietary to our practice to help with like post-infusion fatigue. I don't want to give away all of our secrets, but you cannot do that intramuscularly. So we can really titrate to perfection. And then looking at like, I want people to be in this like plasma concentration where they can navigate the experience. Intramuscular, sure, it is very psychedelic, but it's more of a roller coaster ride. And then you're going for the ride, and I want you to be able to navigate this steady state of ketamine. And that's being in that non-ordinary state of consciousness allows you to have these potential breakthroughs and insights.
Yeah, that makes sense. Absolutely. And I think, IV, therapy in general just definitely sounds like something I would lean into. A
little bit more control.
As well, yeah.
It's a cost thing too, though, as well. Like I could teach a chimpanzee to give you an intramuscular shot. I literally could. Whereas IV is a skill and there's more equipment around it too. So people are looking for like a lower cost model. You can do more of a community setting with intramuscular. I will give it that in like sublingual or nasal. But we're definitely biased in certain ways, but all of them have their reason to be used on certain patients and they all their validity for sure. So I'm open to all of them. We still done intramuscular in our clinic as well. Someone, if they have really bad veins and you can't access them because they've done IV drugs, then I don't want to traumatize them, right?
Sure.
So then we might go intramuscular. So we're open to all routes, but like you said, the Rolls Royce is IV.
That's great.